Alert 8. Fruits seniors should never eat, shocking health risks. Health Aura. Know it right, live it light. What if the fruits you've always believed were healthy are actually making things worse as you get older? Sounds surprising, right? While fruits are packed with vitamins, minerals, and antioxidants, not all of them are ideal for seniors. As we age, our metabolism slows down. Digestion changes and medications become part of daily life, making certain fruits less friendly than we think. Some are high in sugar, others too acidic, and a few can even interfere with common prescriptions. In this video, we're uncovering 8 fruits that older adults should either limit or avoid to protect their health. Whether you're caring for aging parents or looking after your own well-being, this information could help you make smarter, safer food choices. Which fruits made the list and why? Stick around to find out. And if you find this content helpful, don't forget to like, share, and leave a comment to support our channel. 1. Dwarf pineapple, the tangy trouble for aging, digestion, and teeth. Pineapple, tropical, juicy, and bursting with flavor, might seem like a healthy treat, but for seniors, this vibrant fruit can quietly become a source of discomfort and risk. Its bright sweetness masks a high level of acidity that's particularly harsh on aging digestive systems. For older adults dealing with acid reflux, GERD, or chronic heartburn, pineapple can quickly turn from a refreshing snack into a trigger for unpleasant symptoms. The fruit's acidity irritates the lining of the esophagus and stomach, making it harder for those already struggling with digestive conditions to maintain comfort after meals. Adding to the problem is an enzyme found in pineapple called bromelain. While often praised for its anti-inflammatory effects, bromelain can actually cause digestive upset in sensitive individuals. Nausea, diarrhea, bloating, and even vomiting have been reported in people who consume pineapple in large amounts, particularly seniors with weakened digestive function. The combination of high acidity and enzymatic activity creates a double burden on an already fragile gut, making pineapple one of the fruits that should be approached with caution. But the risks aren't limited to digestion. Pineapple can also take a toll on dental health, another area of concern for seniors. The same acids that irritate the stomach can also erode tooth enamel, leading to increased sensitivity, a higher chance of cavities, and even gum disease. For aging adults who may already be dealing with enamel thinning or dental restorations, frequent exposure to acidic fruits like pineapple can accelerate deterioration and lead to painful or costly dental treatments. That said, pineapple doesn't have to be entirely off-limits. For those who enjoy it, moderation is key. Opt for small portions, pair it with less acidic foods, and always rinse the mouth with water afterward to reduce the acidic impact on teeth. Steamed or lightly cooked pineapple can also reduce its acidity and enzyme activity, making it gentler on digestion. With a few thoughtful adjustments, seniors can still enjoy the taste of pineapple without the unpleasant side effects. Bananas, a gentle fruit with hidden dangers for seniors. They're soft, easy to eat, and often praised as nature's perfect snack. But beneath their friendly appearance, bananas may not always be as harmless as they seem, especially for seniors. While these golden fruits are often considered a go-to option for older adults due to their potassium content and convenience, there's a deeper story that deserves attention. For seniors with kidney concerns, bananas can quietly pose a serious health risk. That's because bananas are rich in potassium, a mineral essential for heart function and blood pressure regulation, but only when kept in balance. When kidney function declines, as it often does with age or in chronic kidney disease, the body struggles to eliminate excess potassium. This can lead to hyperkalemia, a condition that may cause muscle weakness, fatigue, numbness, and in severe cases dangerous heart rhythm disturbances or even cardiac arrest. The risk increases for those taking medications like ACE inhibitors or potassium-sparing diuretics, both commonly prescribed for high blood pressure or heart failure. These medications already elevate potassium levels, and adding bananas into the mix can tip the scale toward danger without warning. But the issue doesn't stop there. Overripe bananas, though sweet and soft, lose their fibrous benefits and become increasingly starchy. This shift in texture and composition can actually worsen constipation, an already frequent concern in older adults due to reduced mobility, slower digestion, and medication use. Rather than aiding digestion, overly ripe bananas may end up slowing the gut even further. For seniors, the key is mindfulness. If bananas are to remain on the menu, choosing firm, just ripe ones and consuming them in moderation under medical guidance is essential. What seems like a simple fruit may hold surprising power over your well-being. 3 dried fruits, a sweet trap for the aging body. They seem so innocent, tiny, chewy, and bursting with natural sweetness. Dried fruits like raisins, apricots, and dates are often seen as a health-conscious choice, especially for seniors looking for easy snacks. But don't be fooled by their size or reputation. Behind their shriveled skins lies a concentrated dose of sugar and fiber that can overwhelm an aging body's delicate balance. When fruit is dried, its water content vanishes, but the sugar remains. What's left is a compact, sugary morsel that can deliver the same sugar load as several pieces of fresh fruit in just one handful. For seniors with diabetes, or those walking the fine line of insulin resistance, this can quickly become a blood sugar nightmare. A small serving of dried fruit can cause an unexpected glucose spike, complicating efforts to maintain stable energy and mood throughout the day. But sugar isn't the only hidden danger. Dried fruits pack a powerful punch of fiber, and while fiber is essential for digestive health, too much at once, especially in such a concentrated form, can cause bloating gas or even diarrhea. Seniors with IBS, diverticulitis, or generally sensitive digestion may find that dried fruits worsen their symptoms, triggering discomfort or flare-ups that can linger for days. Then there are the preservatives, sulfites in particular. These are commonly added to dried fruits to enhance shelf life and keep the vibrant color. While harmless to most people, sulfites can provoke allergic reactions or asthma-like symptoms in sensitive individuals. Seniors who already face respiratory challenges must be extra cautious, as these additives could silently exacerbate breathing difficulties. The takeaway: while dried fruits can still have a place in a balanced diet, moderation and awareness are crucial. Always read labels, choose unsulfured varieties, and if blood sugar or digestion is a concern, reach for fresh fruit instead. Your body will thank you. Mangoes, sweet, juicy, and surprisingly risky for seniors. They're golden juicy and taste like sunshine. Mangoes are often a favorite fruit, especially in tropical regions thanks to their rich flavor and creamy texture. They're also packed with nutrients like vitamin A, which supports vision and immune health, and vitamin C, which helps protect cells from damage. On the surface, mangoes seem like the perfect healthy snack, but for older adults, this beloved fruit may come with some hidden downsides. As we get older, our bodies become more sensitive to the foods we eat, especially when it comes to sugar and calories. That's where mangoes can pose a problem. One of the key issues with mangoes is their high natural sugar content. Unlike berries or apples that are lower on the sugar scale, mangoes are considered a high glycemic index GI fruit. That means they cause blood sugar levels to rise more quickly after eating. For seniors who have diabetes or are trying to prevent it, this kind of sugar spike can be tough on the body. Why is that important? Because sudden rises and falls in blood. Sugar can leave you feeling tired, irritable, or even dizzy. Over time, these spikes can lead to more serious complications, things like nerve pain, vision changes, or trouble with healing. So while mangoes do offer plenty of nutritional benefits, they can work against you if you're trying to manage your blood sugar or energy levels. Another thing to keep in mind is that mangoes are calorie-dense compared to other fruits. That means even a small serving can pack in a lot of energy. For someone with a fast-paced, active lifestyle, that might be fine. But many seniors naturally move less and have slower metabolism. Eating high-calorie fruits like mangoes regularly, especially without balancing it out with activity, can contribute to gradual weight gain. And as we age, carrying extra weight becomes more than just a cosmetic concern. It can affect joint health, heart function, and even breathing. This doesn't mean mangoes need to disappear from your plate entirely. If you love them, you can still enjoy them, just more mindfully. Try having a few slices instead of a whole mango. Combine it with a source of healthy fat or protein like a handful of nuts or a spoon of plain yogurt. This slows down how fast sugar enters your bloodstream and makes it easier on your body. And always check with your healthcare provider. If you're managing a condition like diabetes, they can help you figure out how much fruit is right for your diet. In short, mangoes are not bad. They just require a little extra thought as you get older. Like many things in life, it's all about balance. 5 figs, a fiber-rich fruit with hidden risks for seniors. Figs have long been celebrated for their sweet taste and impressive fiber content, often seen as a natural remedy to support digestive health. But while they may offer benefits in moderation for seniors, figs can easily turn from helpful to harmful if not consumed with care. As we age, our digestive systems naturally slow down, making it harder to process certain foods, especially those rich in fiber. Figs, whether fresh or dried, are packed with both soluble and insoluble fiber. While this is typically a good thing, too much fiber at once can overload the digestive system. For older adults, this can lead to bloating, constipation, or in more severe cases, even intestinal blockage. Seniors with sensitive guts or conditions like IBS and diverticulitis may find that figs trigger discomfort or flare-ups, especially when consumed frequently or in large portions. Adding to the concern is the fruit's natural laxative effect. While that might sound like a plus for those struggling with constipation, it can easily swing the other way. Overconsumption may lead to diarrhea, or worse, dehydration, a serious issue in older adults that can worsen existing conditions such as kidney problems or contribute to urinary tract infections and confusion. Moreover, figs are deceptively sweet. Their high natural sugar content can lead to rapid blood sugar spikes, which is risky for seniors managing diabetes or insulin resistance. Dried figs in particular have even more concentrated sugars and should be limited. To enjoy figs safely, it's best to opt for small servings of fresh figs and pair them with protein or healthy fats to reduce glycemic impact. Moderation is the key to keeping this fruit friendly. 6. Lychees. The exotic fruit that may not be as gentle as it seems. They look like tiny jewels, tender, fragrant, and bursting with tropical sweetness. Lychees are a beloved treat for many, often enjoyed chilled on a hot day, or added to desserts for a refreshing twist. But while their delicate flavor may win hearts, these fruits can pose hidden risks, especially for seniors. One of the most unexpected dangers of lychees is their effect on blood sugar. Unlike most sweet fruits that raise glucose levels, lychees, when consumed in large quantities, especially on an empty stomach, have been linked to episodes of hypoglycemia or dangerously low blood sugar. This paradoxical effect has been documented in medical studies and is especially concerning for older adults with diabetes or those taking medications that lower blood sugar. For seniors, a sudden drop in blood glucose can trigger confusion, dizziness, weakness, or even fainting, raising the risk of falls, injuries, and medical emergencies. To minimize these risks, lychees should never be eaten alone on an empty stomach. Pairing them with protein, healthy fats, or fiber-rich foods can help slow down sugar absorption and keep blood sugar levels stable. Small servings, just a few fruits at a time, are far safer than indulging in large portions. Another important consideration is the potential for allergic reactions. While rare, some individuals may experience symptoms such as itching skin rashes or even difficulty breathing after eating lychees. Seniors with known sensitivities to other tropical fruits or a history of allergies should be especially cautious and monitor for any adverse effects. In short, lychees can still be enjoyed, but they demand respect. With a mindful approach, this tropical gem can remain a delightful treat, rather than a hidden danger. 7. Pomegranates, a superfruit with surprising risks for seniors. They glisten like ruby jewels and have earned a glowing reputation as a superfruit. Pomegranates are celebrated for their rich antioxidant profile, especially their polyphenols, which are believed to fight inflammation, support heart health, and promote graceful aging. But while this fruit may seem like a nutritional powerhouse, it carries risks that many seniors may not expect. One of the most serious concerns lies in how pomegranates interact with medications. For seniors taking blood thinners like warfarin or other anticoagulants to prevent strokes or heart attacks, consuming pomegranate juice or seeds could unintentionally amplify the medication's effects. This may increase the risk of excessive bleeding or bruising, even from minor bumps or injuries. Pomegranates may also interfere with drugs used to manage blood pressure and cholesterol, potentially altering their effectiveness and leading to unpredictable results. This is why seniors, especially those on long-term medication plans, should always consult their healthcare provider before incorporating pomegranate into their regular routine. There's also a more practical issue. While the seeds inside a pomegranate, known as arils, are nutrient-rich, they can be difficult to chew and digest. Seniors with dentures, tooth sensitivity, or weakened gums may find the crunchy seeds uncomfortable or even painful. In some cases, swallowing them whole could present a choking hazard or lead to digestive discomfort. For those with slower digestion or gastrointestinal issues, the fibrous content may cause constipation or irritation. Enjoying pomegranate in moderation, opting for juice in small quantities, cherries with medical guidance,
A sweet
or
temptation
choosing
that may
seedless
drain
extracts
more than just
may
your
offer
cravings.
a safer path for
There's something
seniors to gain the
irresistible
benefits
about a bowl
without
of fresh
the unexpected
cherries.
downsides.
Their
Their glossy skin, sweet tart flavor, and refreshing juiciness make them a summertime favorite. But for seniors, this innocent pleasure may come with hidden complications that are easy to overlook. Cherries, while rich in antioxidants, and vitamin C, also contain a significant amount of natural sugars. For older adults living with diabetes or struggling with blood sugar control, these sugars can quietly disrupt delicate glucose balance. A handful of cherries may seem harmless, but overindulging can trigger blood sugar spikes, leading to fatigue, irritability, or even long-term complications if not monitored closely. Beyond their sugar content, cherries have a natural diuretic effect, meaning they encourage the body to release more fluid through increased urination. While this may seem like a minor concern, it becomes more serious for seniors, especially those already on diuretic medications for high blood pressure or heart conditions. The combination of medication and cherries can amplify fluid loss, making dehydration a real threat. And dehydration doesn't just mean thirst. It can lead to dizziness, confusion, and urinary tract infections, all of which can significantly impact an older adult's safety and quality of life. For seniors who love cherries, the key lies in mindful enjoyment. Limit portions, avoid eating them in isolation, especially on hot days, and stay hydrated throughout the day. Pairing cherries with a protein or fat source, like a few almonds or plain yogurt, can also help stabilize blood sugar and ease the impact on the kidneys. With thoughtful balance, cherries can still be part of a joyful, health-conscious diet. 9. Fruits seniors should rethink navigating. Sweet choices for better health. Eating well becomes even more important as we age for seniors. A healthy diet isn't just about staying fit. It's about managing chronic conditions, maintaining energy, and protecting overall well-being. Fruits, with their vibrant colors and rich nutrients, are often considered a cornerstone of healthy eating. However, not all fruits are equally beneficial for older adults. Some fruits, despite their health halo, can carry hidden risks. Pineapples, for instance, may worsen acid reflux due to their high acidity. Bananas, though potassium-rich, can be problematic for those with kidney issues. Dried fruits are loaded with concentrated sugars that can spike blood sugar levels quickly. Even seemingly healthy options like mangoes, figs, lychees, and pomegranates can cause unexpected problems ranging from digestive discomfort and dehydration to interactions with common medications. That's why it's so important for seniors and caregivers to approach fruit choices thoughtfully. While these fruits can still be enjoyed, moderation and context matter. Pairing them with balanced meals, understanding portion sizes, and being aware of how they interact with medications can make all the difference. Most importantly, always consult a healthcare provider to tailor dietary choices to individual health needs. Making informed decisions about fruit isn't about restriction. It's about smart choices that allow seniors to thrive. If you found this guide helpful, don't forget to like, share, and spread the word, so more families can support healthy aging with confidence.